So firstly, you'll notice all your microphones are muted. This is just to make sure we get good sound quality during all the presentations. And we ask that if you have your webcam on, that you turn that off. Go to the discussion section. If you can indicate that you want to make a comment or ask a question, we'll have you unmute your microphone so that you can ask it in person. On the hand side of the screen, then, you'll see that you have a chat box function. So if you'd like to ask a question of the speakers, please type them in as you go, and I'll come to you after the speakers have finished. So I do encourage, if you can, to ask your questions in person. This just makes it a more kind of interesting session and a friendly experience for the speakers. But if you aren't able to do so, for example, if you don't have a microphone, then you can just type your question into the box and I'll ask it on your behalf. So that is also recorded and will be uploaded to the Fulham Lives National Evaluation website after today. So should you wish to revisit the webinar, it will be available, and we'll send you the link when it is available and uploaded. That agenda for the day. I'd like to thank all our three speakers for joining us and making the learning opportunity possible. So this morning we have Rachel Morriton, Associate Director at CFE Research. Rachel will be sharing insight from the National Evaluation of the Fulfilling Lives programme. Following Rachel, we'll hear from Ian Treasure, Programme Manager of Blackpool Fulfilling Lives, who'll be discussing the role of the Navigator. And then the webinar, we'll hear from Ray Clark, Service Coordinator at Fulfilling Lives, Islington and Camden, who'll be discussing female-specific engagement. So further ado, I'd like to hand over to Rachel, who will be our first presentation. Over to you, Rachel.
Just the controls to me.
Yeah, now you should have the.
And thank you everyone for this morning. I'm going to sort of kick things off by an overview of the latest findings from the National Evaluation of the Fulfilling Lives programme, and hopefully set the scene for the presentations for the rest of the day. Good morning. A summary of findings from a series of 4 briefings that we published throughout 2019, and these draw on data that we've collected on up to 3,000 people affected by multiple disadvantage who have been supported by the Fulfilling Lives programme. And you can see all 4 briefings on the Evaluation website, and we'll provide you links and details at the end of the webinar. But very briefly, just a little bit of background and information about the Fulfilling Lives programme for those of you who may not be familiar with it. So Fulfilling Lives is a National Lottery Community Fund programme. They've made a major investment in different parts of England over an 8-year period. The aim is to improve the lives of people affected by multiple disadvantage by having to access more joined up and person-centred services and support. But it's about changing lives. It's also about changing the wider systems so that actually any changes that we see are sustainable beyond the funding period. The key element is involve people in designing and delivering the programme, involve people who the programme aims to benefit in achieving that change. And the Community Fund CFE Research, working in partnership with the University of Sheffield to carry an overarching evaluation of the programme. But we'll also hear from 2 of those that have received funding in the webinar today as well. So just to begin by unpacking what we mean by multiple disadvantage, particularly on this programme. The programme is multiple disadvantage as experience of 2 or more of homelessness, substance use, rending and mental health. And here shows that among Fulfilling Lives beneficiaries, actually over half are affected by all 4 of those particular needs. Almost all are affected by at least 3. And we'll see they're also likely to experience a range of other factors as well. So why do we need to invest in multiple disadvantage? Why is this something that should be on the policy agenda? Well, I know, and we've collected data on use of a range of different services that are affected by multiple disadvantage or make disproportionate use of, in particular, crisis and emergency services. That's to say that everyone does. There are some people who actually make very little demand on public services. But to give you a flavour, in the first 3 months of joining the Living Lives programme, which we take as a baseline period, at least 1 in 4 attended A&E at least once, and for some people it was on occasion. So, for example, one person attended as many as 25 times in a 3-month period. And with qualitative data that we also collect, that this is often because people feel excluded from other services or find it difficult to get the help that they need elsewhere, and therefore they feel compelled to resort to other, perhaps less appropriate channels. Substantial cost to the public purse. Estimated that on average, benefit of the FLIC programme using on about 5,000 public per person per year. That's in with other estimates for this group, but we also probably get an underestimate because we own data on a sort of limited selection of public services, and there will be others. Also, disproportionate when you compare the use of similar services to the population. School impact, though, there are also serious social and economic costs. For example, 58% of beneficiaries were homeless for at least some of the time during their first 3 months on the programme. A quarter, 25%, at least some of that time rough sleeping. And furthermore, so 1 in 4 people were arrested at least once for the same period. We know there's sort of a high level of use of an interaction with the criminal justice system amongst beneficiaries. Importantly, what all these statistics represent is actually just a waste of human life. And perhaps the stockiest big reports this year is the fact that since the programme, 171 people died, sadly, and that's 5% of all of those who engage with the programme, 2014. And actually, that figure was correct when we collated the data for these reports earlier in 2019. It has undoubtedly increased since, and in fact, I know it has. It's really compelling evidence of why this is an important topic to explore and look at what FLIC in particular has been doing to improve the life for this group of people. So the FLIC beneficiaries were telling us that people with multiple disadvantage are often labelled as hard to reach, difficult to engage, too high risk to support. The success of the programme, the achievements is that they have rated it is possible to engage and work with people with the most severe and entrenched needs who are not otherwise getting help, and that was a particular focus and a goal for the programme. So we've all the beneficiaries are affected by 3 of the 4 defining needs, 94%. There's an overlap between people affected by mental ill health and substance misuse. And we know from other work that this can be a major barrier to people getting help. Comes in a catch-22 type situation where they can't access mental health services because of their substance misuse problems, but they can't access substance misuse problems because that's how they cope with mental health issues. Actually, we're going to be publishing an in-depth report on that topic in the new year, about mid-January time. So do look out for that. We'll explore that issue in a lot more depth and provide some examples of how Fulfilling Lives partnerships have been addressing that, and also what still needs to change. That are effects the benefits of the programme. So 41% have other disabilities or long-term health conditions in addition to the 4 defined needs. A much higher proportion than the population as a whole, which is about 8%, I think. 30% have problems with literacy. And data on this ourselves as part of the programme. We also know from the wider literature, from other studies, that association between multiple disadvantage and adverse childhood experiences, compound and complex trauma, for example. People affected by multiple disadvantage, the data shows that people in the programme are seeing that a difference is being made. So here, after 12 months, we can see a reduction in the use of those negative and crisis services that I was talking about. We see fewer arrests, fewer cautions, convictions go down, visits to A&E reduce, as do evictions from sentences. Movement in people's housing, so rough sleeping drops from 25 to 14% over that year. And similar reductions in people staying in temporary accommodation like hostels, and increase in people in supported accommodation or their own tenancies. Risk people experience, but also their needs, and improvements in self-reliance and well-being. So there's rest. To emphasise here, and a key ingredient of fulfilling lives is they go at the pace of beneficiaries and they focus on what matters to them, and therefore is really needed over the long term, rather than something more impersonal, with goals just through people. Takes a more personalised and tailored approach. So, who have left with the programme to a positive destination, so because they no longer need help or they're getting support that they need elsewhere, on they stayed on the project for 14 months, but in the programme for as long as 4 years before they achieved that positive move on. And more detail, it looks like Fulfilling Lives makes some really good initial progress when people join in addressing most and pressing needs, so getting people into accommodation, sorting out benefit, entitlements, getting medical help, etc. But then the sort of address the underlying needs, often that stem from that trauma I mentioned, that's a much longer term endeavour, and I think it's important to emphasise that longer support is needed. This isn't something that can be fixed quickly necessarily. The nature of people's journeys is that people relapse, they will drop out, they will face setbacks. That is part of the journey to recovery and to a fulfilled life, and therefore something that services to be expected rather than something that's punished. For example, we hear about people having support cancelled because they've missed appointments, for example. And the project was really hard to avoid closing cases, keep on board. The door was open, so people do drop out, then often more than re-engage when ready. And of all who have left the programme for whatever reason, about 2% did say dropped out, they disengaged. Interestingly, we have collected some data from some other projects working with people affected by multiple disadvantage, but actually people with less complex and less severe needs. And we found that the dropout from Fulfilling Lives was actually lower than some of the programmes. So doing something right and it's keeping people engaged. Another what kind of support is it that seems to make a difference? So we've got data on a range of different support services that people might use. And that stood out over the first sort of 9 months or so, associated with people making greater progress towards well-being, improved well-being and self-reliance. And getting specialist support with substance misuse, improvements in well-being and self-reliance, but counselling and therapy was linked to improvements in people's emotional and mental health. And we've done that analysis more recently, where we looked at a longer period of time, 18 months. And again, thing that counselling and therapy is associated with people making greater progress. So, and perhaps not surprising that those services can be effective. I think what's more shocking is that so few people with program actually receive that type of support. At the start, in those first few months, only 17% of those with a mental health need had received any type of counselling or. And you can see that that gradually increases over time. It's the case that everybody receives that kind of support. So that there are still significant barriers to getting access to mental health problems for people experiencing multiple disadvantage. And again, look out for that report in the next month. Fulfilling lives that help people to connect with services are Navigators. They come under a variety of different titles: personal development coordinators, key workers, support workers, so forth. We're hearing a lot more about the role of Navigators in the next presentation. Again, going back to the point I made earlier about the need for long-term support, this enables Navigators to build sort of personal relationships based on trust with beneficiaries, therefore work with them to help them to identify the services and support they need and connect them in. And often also act as advocates on beneficiaries' behalf when they identify someone's not getting their entitlement or services that they need. And we sort of see the impact of Navigators as the use of different types of services gradually increases over time. But I also know that there's much a Navigator can do to sort of connect people to services. You need services that are both accessible and appropriate for this group to be in place in order for them to be linked into. Just like a little bit about women, particularly as our third speaker today, we are focusing on this in more detail. Some researchers tended to perhaps characterise multiple disadvantage as largely a male phenomenon, but there's also an acknowledgement that because of women's experiences are different from men's, they might not show up in some statistics. They've also seen recent reports in the last year or so emphasising the need for gender-specific services supports that. So Fulfilling Lives as a whole has been, I'd say, successful engaging women with experience of multiple disabilities. About 35% of beneficiaries are women. But they're all. So we also know that the proportion of beneficiaries who are female is much higher at some partnerships where are particularly focused on working with women or offer a specialist service aimed at women. It also shows that when women join, in some cases they actually have higher levels of overall need than men, and in particular they seem to be at higher risk of harms, and also generally have worse scores on indicators of mental and emotional well-being. And that being female was a predictor of increased likelihood of leaving the programme with a negative destination. So that includes just dropping out, maybe going to prison, or indeed dying. Overall pattern across all partnerships, we also know that some partnerships have been more effective at providing that specialist and tailored support that women need. And again, as I say, we'll hear more about the work of one of those partnerships in the webinar. Hopefully that's given you a flavour and sort of an introduction to the Fulfilling Lives programme and multiple disadvantage. I mentioned other briefings that provide those in a lot more depth are available from the evaluation website. That's fulfillinglifeevaluation.org. And you can also sign up on that website to our newsletter to stay in touch. We send out a quarterly newsletter, so you'll be able to find out the latest findings and reports and events. That's nationally as well. So hopefully that was useful. Got a bit of time if anyone has any questions. Thank you.
Thank you so much, Rachel. Really good to get kind of an overview of the project and the work that the National Evaluation team are doing at the moment. If it has got any questions, could you just pop them in the chat box function that's at the bottom corner of your screen? I was just going to ask, is there what's kind of the upcoming work for the National Evaluation? Is there anything people or attendees can look out for coming next?
Yeah, is the access to mental health services report that I mentioned. So due to publish in June, and that will coincide with some work that the Fulfilling Lives partnerships are doing on looking at improving access to mental health services for people who are also affected by substance misuse. So that report will look at some of the barriers, but we wanted to particularly focus on some of the solutions that partnerships have come up with. So 5 case studies and also some recommendations made by the partnerships for how the system and services for this group could be improved. Other things we're looking at, we are doing some detailed analysis of our statistics data to pathways through homelessness for people affected by multiple disadvantage. That sort of we can see a reduction in homelessness and a reduction in rough sleeping, but that's not for everybody. So it would be quite interesting to look at people moving to different types of accommodation over time. And we're also going to be doing some work. We've not started it yet, but we're planning to do some work around workforce development. What is for people who are working to support people affected by multiple disadvantage, but also what are the wider needs in terms of people whose job, that's not their main job, but they do come into contact regularly with people affected by multiple disadvantage. So paramedics, GP receptionists, things like that. So that's some of the things that we've got coming up.
I look forward to them. So I'll now hand over to Ian Trevor. So Ian is from Blackpool Fulfilling Lives, and it fits quite nicely with the end of Rachel's presentation, as Ian will be discussing the role of the Navigators. So just handing this over to you, Ian.
Thank you much, Beth. Thank you. Morning, everybody. Hope well. I've got a presentation, just a few slides to go through. So following on from Rachel's overview about the national programme and the national evaluation, and we're covering some of our experience from one of the Fulfilling Lives programmes, which of course is Blackpool, around all of the Navigator, some of the lessons learned from our local evaluation that's done by an independent company called Bright, some of the conclusions from that evaluation and the lessons learned, and then also feedback from beneficiaries, their experiences of Blackpool, and then just a little bit about the next steps, because as you'll know, the Fulfilling Lives programmes are time limited. We are Petrish, we're an experiment, as well as helping people. We're also hoping to create some of that evidence base that Rachel articulated, and a lot of our findings are, as you would imagine, those that have been found nationally as well. So first thing, just to sort of cover with the presentation is quite a slide this, but just some of the key points really about the role of the Navigator and what makes it different from other services. So the thing to point out is that I've noticed locally and nationally that the word Navigator is being used for an awful lot of things, and what I'd like to do is distinguish the difference between a navigator that's maybe a sort of health coordinator working in the new neighbourhoods as part of the integrated care systems locally. Distinguish that from the navigator, somebody who works with multiple disadvantage, because clear client group, you know, the one most complex in the local population in terms of their health needs, so functioning, criminal behaviour, etc., is around communication. I think about it, someone who's got multiple disadvantage, who's used to feeling stigmatised, who's feeling that there's nobody there for them, they may have, through their own choices or failure to keep appointments previously, become engaged from services and actually got quite a lot of resentment towards the services in terms of no one's helping me. And that communication barrier is absolutely key, because it's about trying to reframe those services and how accessible they can be with some simple steps, but also making sure that system change can occur within those services, so that maybe there's a bit more tolerance and understanding about facing somebody with multiple disadvantage. And what I mean by that is that if you struggle to read printed text, or even if you've got a real phobia about opening letters because they're always bad news, you might not open that letter and you might miss appointments. Couple that with the fact that you may not have a fixed address, you may be using an insecure post box with a friend or associate, or maybe even service to receive that mail, can make it quite difficult for what we assume to be sort of normal communication. People who experience multiple disadvantage find that extremely difficult. So the navigators that we've got in Blackpool, they find the person and not the problem. I think that's a key distinction to make. Instead of saying to somebody, "What's the matter with you?" which is the classic sort of generic point of an assessment, we ask people what matters to you. And we've found some of the therapeutic activities that we can facilitate very cheaply can be really effective in helping to connect people. As we were saying before, about those sort of milestones, if we can keep somebody in service for 2 months, they'll stay with us for 12, and that's where we start to realise some of the benefits of the local system, but also start to notice through the ongoing reassessment of people that we do very subtly, that they're starting to make progress as well. And that's absolutely key to try and imagine that we're not just doing an assessment and getting somebody involved in a key worker. We make a second appointment, take somebody bowling or by fishing rod if going fishing is the thing that helps them to relax and to feel there's some purpose to life. And daft as that may sound, actually the key that can lock that relationship, and we found that time and time again. So I think for those of you that are working in commissioning, or those of you that are working in sort of government think tanks or civil service or the departments or the police or in health, because I've noticed from the attendance list there's a broad here this morning, that when you're thinking about commissioning a service like this, I think the first thing to say, a plea really would be to make sure there's some funds available for therapeutic activities, but also to make sure that the service is commissioned totally differently to other services, and not to lump a Navigator function onto, say, a mainstream drug service or a mental health service, to make sure this is something that's standalone, that can really be that advocate for that individual, but also can help to persuade local systems to change. And that's not criticising local systems, because there's some really good work going on with the resources that we've got. It's to say that the Navigator function really, for multiple disadvantage, has to be very different to anything else. There needs to be that time that the Navigator's got to work with that individual to make sure that they can build up that relationship, and to make it really clear to that individual that we're here for them, and that there's no ulterior motive for them, and to see things through the lens of life. So when I started a couple of years ago in Blackpool, after about 2 months, I realised that I had absolutely no idea what my team was facing day to day. So I dressed down for a week and I went out and I followed them round, and it was really eye-opening. So if you, at the end of my presentation, or in fact this morning, thinking I don't understand what the Navigator does, please do contact your local Fulfilling Lives programme, and anyone that wants to come to Blackpool, from the northwest, do get in touch, because I'd be more than happy to host you for a day, and you could come and spend a day with us. What we do, and one of the things you'll find from the beneficiary feedback, is that we provide people with hope. Although that might sound very fluffy, if you imagine someone who's very engaged from local services, and is really struggling to sort of get along with what they need to do in order to get the help they're looking for, I think it's really important just to bear in mind that takes time, and that the role of the Navigator is absolutely key to making sure that time's available. So look at a caseload of about 10, and that's something that's been mirrored across the country. So another slide. So just moving on, some of the conclusions from our evaluation. I've just covered the first one. Long-term intensive work with smaller cohorts is effective. So our Navigators in Blackpool carry a caseload of about 10. And on that caseload, some of them are people that we've got daily contact with. Others are people who we may meet with once a week or once a fortnight, who've maybe been with us a bit longer. And then, of course, because the client group's very, very complex, the beneficiaries quite often don't have a fixed address. They may be rough sleeping, although in Blackpool we reliably informed that it's not, that the number's not. Some people would say it's about 15. But we've also got lots of people who, of course, are homeless with no fixed address. So we may find those people difficult to find, and then we bump into them, and then we start the work again. So the door's always open. We don't close cases down, even if people haven't been on for a while. We make sure that we're still there and available when they want to get back in touch with us. We've got the first pilot in Blackpool, which is working really well. Again, that's working more intensively with people, and Housing First, the model, of course, is that you find accommodation and you build the support around that accommodation. So the full Lives Navigators that are on Housing First are doing excellent work. One of the evaluation, I think it's really important to mention this, is around the workforce. So I'll just spend a minute or so just reflecting on this. Starting in Blackpool, we had quite high levels of sickness absence, something which was mirrored across all the Fulfilling Lives programmes. And the absence reason was quite often the symptom and not actually the cause. If you're working under stress, and it is very stressful, and you're working with clients who require 100% concentration all the time because they're very complex. Also may present as aggressive and disenfranchised and all of that. It gets quite draining. So it's about making sure that you sort of look after your workforce. And I think one of the things that we've found to be really useful in that is to make sure we've got regular contact with our navigators. And some of the project management methodology that we employ in Blackpool helps us to do that, so that managers have got clear sight of everybody when they're on shift, as well as the team leaders. Quite a lot of staff will have the adult experience. We're all human. We've all experienced things in our lives that may be triggered through some of this work. And also, you know, if you're more susceptible to that, then burnout's quite likely as well. Succession planning is really key, so that you've got new people that you're in up to, either through volunteer routes, or in Blackpool we had an associate navigator model, which is for people who've got previous work experience but who've got lots of life experience in recovery from mental health issues or from substance misuse. And we gave them a smaller caseload, provided them with training, including MVQ level 3 in social care. And after a couple of years, then they had the opportunity to apply for a navigator role full time, or, as happened in a few cases, people said, well, I really enjoyed the experience, but I'm going to go off and do something else. So it's important to make sure that the staff who navigate the roles, after a couple of years, are encouraged to move on to maybe look at working adult social care, or maybe working mental health services, because working with multiple disadvantaged clients for a long period of time is extremely stressful. Just our experience of working in Blackpool. In terms of the team, it's important to have that balance between people with lived experience and professional backgrounds, and that balance we've got in Blackpool is about 40-60, so 40% lived experience, but also professional, and 60% of the people who've worked in the field for quite a while. So making sure that staff have got the opportunity to get involved in innovation. You don't employ brilliant people and then tell them exactly what to do. You employ brilliant people and then ask them what we should do that collaboratively. In terms of some lessons learned, I'll just rattle through these. So recruitment, we make sure that we have people from our lived experience team. Those are people who've used services in Blackpool recently. They're given opportunities to get involved. We have them sitting at our board meeting. They openly provide constructive feedback to myself as the lead in front of the board. That's all very transparent. But to involve them in recruitment really helps, because they can just get a feel for whether or not they think an individual will be good to work with this client group, and we listen to that, and that's part of the scoring for selection. We have a methodology which involves flash meetings. That's every morning, 9 o'clock from 9:15. We discuss what work we've got on that day, and that's the opportunity for people to ask for help, and also an opportunity for management to have clear line of sight as to whether or not anyone looks like they're fed up, and just make sure that people are okay. We do live observations in team leaders supervision, so that's with navigators. So either myself or my ops, we will sit in those supervisions once a year just to see what's going on. About the numbers, so we have 4 navigators on shift at the same time, so teams of 4. We used to have teams of 3, but 3 is a bit of a bad number. Triangles should always be avoided for lots of reasons. So we make sure there's 4, and that also provides that resilience if someone's off sick or for annual leave, to make sure that the service can operate. And double opening hours. So when I started in Blackpool, open from 7 AM to 11 PM. When I did a time motion exercise, realised that there wasn't really client work taking place after 8 PM. So we reduced the hours to 9 PM to make sure staff weren't going home at 11:30 and then, you know, taking 2 hours to unwind. So that's really helped as well with sickness and fatigue as well. And the one here, number 7, that's a quarterly and an appeal to any of you in commissioning roles who are thinking about designing a service like this. Do focus more on milestones rather than KPI targets. Working with people with multiple disadvantages is very difficult to put tickets on them because every individual is different. So you look at milestones, and I'm more than happy to talk to anybody offline about what I mean by that. You find that the services runs a lot better, and there's a flexibility to do the work that you really wanted to do. Some of the beneficiary feedback, I'll leave you to read these in your own time, but it's around that compassion about people having time in order to connect with people, really demonstrating through our actions that we care. And there's also that comment there at the bottom, which is very, very strong. Somebody who genuinely believed they wouldn't have survived had it not been for the input of the navigator. So that's very powerful. I think the swear word, just 'cause I didn't want to offend anybody, but it's all verbatim. In terms of next steps, just like all the Fulfilling Lives programmes, we're time limited, so we've got 15 months left. So the last 9 months I've been making sure that all the staff have got individual personal development plans for session training to make sure that they've got opportunities for work in the future. We don't want to lose those skills across Blackpool. We're looking at secondments into other services, and that's happening now. Again, unfortunately, because the system hasn't changed quite enough, if you've got even a historic criminal record, that will be working in probation and some roles within where there's, with vulnerable adults. And I think really we need to look at system change for that, because if somebody's offending is entirely linked to their drug use and they stopped that 20 years ago, they're at no more risk of committing crime than anyone in the general population, in my opinion. But that's probably maybe for another day. So if there's from any government think tanks, if you can have a think about that and how we might be able to change that, because there's lots of talent that we're missing out on in some of the mainstream services that could be available if we could have that system change. And the sharing learning, so that's just making sure that we continue to share our learning across the system in Blackpool, nationally where possible. That concludes my presentation. I've used up nearly all the time. I've been renowned to waffle a bit, but if there are any questions, more than happy to take any.
So much, Ian. We have one question that's just come through from Amanda. So Amanda, I'll unmute you, and if it's worked, you should be able to ask your question now if you're happy to. You might have Amanda. Ian, Amanda, could you just give a few examples of milestones? You were discussing outcomes. Yeah.
So I'd say a milestone would be whether or not somebody stays in service for 3 months. And then another milestone then would be, is there an improvement on things like the Rosenberg scores, Edinburgh, the wellbeing scores? Has their new directions team assessment score come on? So the kind of things which may feel a bit KI-ish, but they allow that flexibility. So if someone's improved one area of their life, but only that one area, that milestone that's seen as success. I would say those are the kind of things to look at, rather than, one of the bits of feedback I got recently when I did a presentation, how many of these people have found work. Well, at this moment in time, there's only a few of them that have found work, but we shouldn't be right. Well, people need to be in work within 6 months, because that's just totally unrealistic, really. This client group, so that helps. More the sort of the softer things that can be milestones rather than hard sort of targets.
Thank you. And we've got another. Oh, there's just asked: are these individual service milestones?
I suppose they are, yeah, because each individual is different, and this is where it could provide a headache for commissioners, really, because I know that when you allocate public money, you want to make sure that you can. I've been a commissioner myself for 7 years, not so long ago. I understand all of that, and I know you need to be accountable, but I would say that you could have individual scores, individual milestones, which could then create service milestones, and then you could see overall there's progress being made. And I think there's a difference between a target and a milestone. A milestone is something that you can report that people look at and progress, whereas API is something where there's a number that you've got to meet, and I think that's where there's a real risk then of really good navigation services for multiple disadvantage seen as being not successful. If we put any KIs in, it just becomes a bit unworkable, and it'll just put pressure services really where they should be allowed a bit more freedom and flexibility to do that work around that client.
Thank you. And then we've got another question from you, so I'll just Jan, and if you're happy to ask a question, please do.
Yeah, hear me?
Yes, Jan, yeah, morning.
Yeah, you're right, mate. Thanks for doing that. Just a quick question, because obviously we're doing a very similar sort of thing here in Birmingham. Yeah. Just wondering if anything specific that you've found, sort of from your conclusions or lessons learned or whatever, had been picked up extra to the programme, sort of going forward. Also than others, because obviously we do a learning and stuff, and some things seem to be pick commissioners and mainstream support and stuff like that, whereas others don't. I was just wondering if anything in particular from your learning has been really useful.
Yeah, one of the things to celebrate here in Blackpool is that the National Probation Service, or the Blackpool office of that, also CRC, of course, which is run by Sodexo in Blackpool, and in fact Lancashire and Cumbria. They've really started to take system change to heart. They've invited our lived experience team in. They've redesigned their waiting room and the way they do appointments. DWP again, with the benefits agency, as it were, the Job Centre Plus, as it was. They've also done the same in terms of how they will speak to somebody who they know has got multiple advantages, rather than interview them in an open plan office, take them into a quiet room and just spend that little bit extra time with them. So that system change, I think, is really, really important to celebrate. And what they're finding is that people are much more likely to keep appointments in the future if that's the first experience of meeting with that service.
What were the lessons did they sort of see specifically then that has made them do that? Do you know?
Yeah, it was very much them realising that there was a bit of a revolving door, which created massive inefficiency for the service.
Yeah.
Created massive headaches for their staff, because they were then constantly trying to chase people around.
Yeah.
And also the staff, know whether or not someone's getting help. And I think you're in a pastoral role, even if it's a formal one, you make sure that you're doing everything so that individual can really, change the fortunes. And they were all realising that it was just a fairly hopeless situation. So I really did take my hat off to them, because it's quite easy when you're in a formal role in public sector and you've got an appointment system and, next person please, just to treat everyone the same. And I think what they've done is they've realised that there is a different way that you can do this. And a lot of the time it's around spotting what are the signs of someone who may be experiencing multiple disadvantage. How do they present? How do they look? What kind of things do they talk about? Do they get worked up easily because they get frustrated? So they've really taken it to heart, and I can't celebrate that enough, really.
Thank you, and thanks for the discussion. That was really interesting. Hand over to Ray, because I'm just conscious of time. So thank you ever so much, Ian. That was brilliant.
Thank you.
I'm coming to unmute you now. So handing over to Ray Clark. Ray is Service Coordinator at FLIC Lives Islington and Camden, and is going to be discussing female-specific engagement. So over to you, Ray.
Morning. Very much for the other speakers. I have really enjoyed them and learned a lot. So I'm going to talk about female-specific engagement and why we work differently with women, and what additional things that they might need. So, talk a lot, and it's not going to be really related to the slides. I'm going to trust you all to read the slides yourselves while I natter. So, just to kind of pull out a couple of things from this slide, FLIC focused on a gender-informed approach to working with women. None of the women we work with have experienced gender-based violence, either in the past or currently, and that's what has been disclosed to staff, let alone what hasn't been disclosed. So we, from the Me Too movement, actually every woman or female presenting person or person who was raised as female has experienced some kind of gender-based violence. And actually, of the women I've worked with, most of them are survivors of childhood sexual exploitation as well. Most of them have been sexually assaulted, and the ones that are in relationships, the likelihood that those relationships are going to involve domestic abuse is that much higher. Challenges when it comes to women are supporting and engaging women who are rough sleeping or active, who are constantly with perpetrators, getting them away from those perpetrators to be able to get in and get that initial contact and get some trust from who's very, very disengaged, and perhaps being blocked from services by their perpetrators can be very difficult. We're being able to engage with domestic abuse services. Domestic abuse services are often very black and very white. They are not designed for, they're designed for like heterosexual housed women. They are not designed for people with immigration issues, people in the street, people with multiple disadvantage. They're not flexible, and a lot of DA law is actually very black and white as well. We'll come to that. A lot of clients are able to access or sustain refuge accommodation or be able to get away from their boroughs. One question always asked is, has she reported this assault to the police? No, she hasn't, and she's not going to. So we need to find different ways of dealing with these women. A lot of the women still aren't deemed priority need housing options, especially in London, if I can't prove that borough has obligation to house them. successes is that 95% of the women who are experiencing gender-based violence have engaged with their link workers for support with the issue. They may not be okay with engaging with domestic abuse services. They may not even consent to max, but they are beginning to talk to us about what they are experiencing, and we are therefore able to tell them about, what domestic abuse is. I worked with a woman 40 years old who did not understand that if she did something one day, she might have the choice whether to do it or not the next day. So, like, basic consent to women, it hasn't been explained. It doesn't, it doesn't. Them, do you know what I mean? And it's when I explained it to her, you could see the light bulb going off over her head. You could see that she really understood that she didn't have to do this. And you can do this one day. You don't have to do it later. You don't have to do it tomorrow. You don't have to do it ever again if you don't want to. And fantastic. We do a lot of joint working. I do a lot of joint working, especially with our local domestic abuse service. I'm going to get that a bit later in the presentation. And using a holistic approach. So building with the women they work with, addressing their needs according to their priorities rather than our agenda. This is just what Ian was talking about, and what he's already covered in detail really is not asking what is wrong, but asking actually what's important to you and how can we help. Outreach, again, Ian's already covered a lot of this with the Navigators, but a lot of our women do go missing. A lot of our women won't be able to be found. A lot of our women, we can go up and meet them from the gates and they've already gone, so find them. And it's about sitting back and waiting for them to come to us, but using assertive outreach, like having really good links with centres, with A&Es, with GPs, drug services, with shops. There is going to be somebody somewhere who is seeing this client regularly. There's going to be someone, there's going to be a way in. And I think, really lucky to be part of a team that use a lot of initiative and a lot of, really innovative techniques. One of my colleagues has a woman who's in abusive relationship, and she has substance misuse problems, criminal justice issues, and getting a message to her was really difficult. And my colleague started using 2 phones and at the pharmacy, so she knew that when a client was on the script, when her client was accessing those services, she was going to pick up those phones, they're charged. They always had credit on, and they always had my colleague's number, so she could just phone and make contact. A colleague would do that again and again and again and again and again. They've been working together for 18 months. And so this client is still with the perpetrator. She started reporting incidents to police. She started keeping hold of phones, calling up my colleague when the abuse was happening. And this is, it's amazing for us. But yeah, just knowing everyone and having really good links with services and the network around the woman, knowing who she is and where she goes and what she does is crucial. Be flexible with early engagement. I know FLIC are really lucky to be able to have a budget to use for engagement, and not all services have that, but there is still stuff to do even though you don't have a budget. So for early engagement is Knickers. I have not met a woman on the street who did not need a packet of Knickers. And there is always, there's always fundraising routes and being able to distribute those. And when I'm working with new clients, I walk around with packets of clean Knickers in my bag, because that I understand where they're coming from, and what they need. I always ask them what they need, quite a lot of the time, what I see as a priority for them, they're not going to necessarily see as a priority for them. They might get their benefits sorted out. They might want to make contact with family. I had one client who wanted me to get in touch with her local authority and find out what happened in the adoption of her son. And that was totally her priority. She wasn't interested in looking at her homelessness or her substance use or her outstanding criminal justice issues until I'd done that. And I gained her trust. age. What do we really mean by that? And again, this has been covered quite a lot by Ian. It's really victim language. You know, if we're calling a woman difficult to engage, I think like that should really be the services making it hard to engage her. So it's more about what we're doing wrong than what's doing wrong. You know, is difficult to engage if you can find a way in. Services can be quite difficult to engage with, I think, you know, if appointments aren't kept, or, you know, the woman I'm working with is exhibiting some behaviours that they will see as challenging behaviour and that I see as trauma reactions. And I think it's really important to be able to advocate for the clients in those times. I've a couple of examples. So, a drug service recently who did an assessment and they asked a question about her children with no framing at all. Not even like, you know, we have to ask everyone this question, or this question might be quite difficult, and about her children. And she told them to F off. And the worker who was doing the assessment then left the room and brought the manager back in and asked, why did you manager back in? And the worker said, oh, you know, I felt threatened. And I'm like, she's not threatening you. She's setting a boundary. She's not doing it in a helpful way. She's not doing it in a socially acceptable way. But that's a trauma response. She's telling you to back off. She didn't threaten you. I think like being there and being able to advocate for those clients and being able to explain behaviours and why they might be seen as challenging or threatening, but actually a lot of the time they're not really, is really vital. So barriers and developing best practice to me a lot of the time is about working with those services to explain trauma response and to explain like what that looks like, and to do that with sounding like I'm telling those services how to do their job, which is cruel, you know. So how to get women to work with us? What do we do? Force people to separate out their different issues. So this is my favourite slide in the whole presentation. My boss did this, and she said here, the skill of support staff should be to have client-led conversations that go and then gradually draw out the different elements of what needs to be done as trust and rapport builds. And this is where, you know, listening to these women really is key, and being able to hear saying and then like revisit the conversation, even like 3 months, 6 months later. I've got a woman who I've been working with for about 9 months, and you know, I was kind of able to say, it sounds like you actually do better when you're not in a relationship. Like, what do you think about that? What do you think that might be about? You know, and we were able to have a whole conversation about how she operates differently and stays out on the street more instead of using her hostel room when she's in a relationship. And, you know, actually managed to get quite deep into kind of like validation and how that's important and where else she might be able to get that, and self-esteem. And yeah, it was really good. So you can't think of a goal, start small. There always is one. So there's always something that they want. There's always something. There's always ID or a bit of shopping or a bit of electric or a phone call, or, you know, there's always something. Real positive, there is always one. There really is. There's something very effective about being able to tell them, yeah, you did do this, but look at what you did. You called me, or you came to this meeting, or you asked for help, or you reached out, or you didn't lose your phone, or, you know, whatever it is that they're either and that they're doing really well. Humour and informality. I rely on humour heavily to connect with my clients, and I think like for all of my clients, I have completely different boundaries. And completely different guidelines as to how to work with them most effectively. So I think of a woman at the moment who I'm working with, who I first came across about 3 years ago when I was working in a night for women who'd experienced violence against women and girls. And when I met this woman, she had been on the street for 3 years. She hadn't claimed benefits. She had 2 pairs of knickers to her name, and she was staying in this night shelter, and she was accessing this night shelter, but nothing else was happening. I was coming at like 6:30 before they chucked out and try and catch her and try and kind of ask what she wanted, and kind of got what she wanted most was to be scripted. But the problem was that she would get up in the morning, she would use, and then she would be gone for the day. And this continued for ages. And I tried loads of different things. I tried taking her to the drug service at loads of different times, and nothing was working. And I wanted to say to her, like, have you tried like just not smoking crack in the morning? Have you tried like so you're not sick? So you know, you've had something that means you're not going to go into physical withdrawals, but just leaving the crack until after the doctor's appointment. Can we try that? And we did it, and she got scripted. And got housed, and she's one of my clients now, actually, which is really lovely. And yeah, she's held down hospital accommodation for over 2 years. She's benefits with her children, you know, and everything got rosy for her. You know, she still has like very severe physical health issues and mental health issues. She's still, you know, not a well woman, and we still have, you know, to go before she achieves what she wants to achieve. But you know, it just goes to show that, you know, with a bit of flexible thinking and getting to know the woman really well, we can start to challenge that. So how much you all know about the role of service coordinators. So I have 6 clients, and we also spend 30% of our time on action experiments, which are basically addressing those barriers that clients encounter that stop them working with the services and help them with their issues. So when I was working in Westminster, I was my role there was to sit at MARAC and be the multiple disadvantage rep, and I carried that over into Camden when I started working in Camden. So I'm assuming you all know what a MARAC is. MARAC is a weekly, no it's not, it's a weekly meeting in boroughs, discuss the most at-risk cases of domestic abuse in the borough. So there are risk factors that you know these incidents might lead to delayed homicides. What I found was that a woman with multiple disadvantage was being referred to MARAC. What would happen is that the actions that came from that would be something like substance misuse. So probably already thought of that. If she's got a drug problem, and she's probably either already engaged or not interested in engaging right now, or indeed being blocked from engaging by the perpetrator. And it's about opening up those conversations and actually going, well, this woman has multiple disadvantage. What can we do to actually make this safer? And this is where challenging those domestic services comes in, who perhaps ring over 3 times, but then go, oh, she doesn't want to engage with us, we can't do any more, or oh, no, we can't go and see the survivor because she's with the perpetrator all the time and they're on streets. And kind of like being creative to work actions that do work. Okay, so you can't get in and support her, but what you can do is maybe support the outreach worker that's supporting the couple, and maybe you can tell the outreach worker what they can be doing to reduce risk, and the outreach worker can relay that to the survivor, and we can reduce risk that way. You know, instead of multi-agency meetings, which my manager developed, which are client-focused and look specifically at the barriers that women are encountering that are stopping them, you know, they want to achieve or being able to reduce some risk around them. Challenging stigma, which unfortunately does still happen even at MARAC meetings. You know, I've heard some truly horrible things, and you know, she does know how to pick them when it's a woman who keeps coming up on the Marac, but with different perpetrators. And it's about, you know, saying to whoever's saying that, well, actually, no, she's so vulnerable that perpetrators are finding it really easy to exploit her. Do you know what I mean? It's not her fault, you know. And if a woman is LGBTQ+, some of the language that can be used around her can still be, you know, quite discriminatory. You know, we have a woman with multiple disadvantage that, you know, heard at Marac, who's a trans woman, and me question language around her. And I think it's just about questioning that, sitting in the Marac and going, well, hang on a minute, this woman is multiple disadvantage. Let's take a bit longer to discuss this case and let's come up with some actions that are actually going to work for this client. And then I've got a couple of slides at the end here that are women telling us what's for them. Just quite nice to read through in your own time, and, you know, validating that personal approach and telling us that they don't want to be told what to do, they just want to be heard. You know, someone that's been through the same stuff, I'm quite open about my lived experience as a survivor and as someone in recovery from addiction. You know, I don't think it's necessary to be a good worker, and I don't necessarily think that I have to be as open as I am. I just an open book, really. But yeah, tailoring that response and asking the woman what they need and how we can help them. So, I am going to leave it there. And yeah, thanks very much.
So much, Ray. That was really interesting. Has anyone got any questions for Ray? Please put them in the chat box. Okay, that I thought of. You mentioned Team Around Me. Could you just give a little more information about that? You said your manager had developed the tools for kind of, yeah, what's it, and does FLIC offer any training?
Mm-hmm. What we were finding was, you know, if we were having multi-agency meetings, it would often be quite confused about who was meant to be taking that meeting, or maybe who was, what outcomes were, what the actions should be. The women were very seldom invited to that meeting. So my manager came up with a structure that starts off with something positive about the client, and then review like what it wants to achieve and what's blocking them from achieving that. And there's like a really clear agenda to follow and a form to fill in so that we can clearly see like what needs to be accomplished and whose job it is to do that. And Lucy is on training with that. And you can contact me and I'll put you in touch with her. I'm also being trained on how to give training in that as well. So hopefully I'll be able to help you pretty quickly. And it's something I really, really, really believe in. And I've also seen it work in kind of a bit restorative justice way as well. So especially with Marac and, you know, maybe the or housing haven't fulfilled actions the way the woman has wanted them to be done, the way that she's interpreted those actions will be done. And it calls for accountability and some explanation towards the survivor to enable them to perhaps like gain a better understanding and feel that services are more applicable to her, which is incredible.
Yeah, that's really good. We've just had a question. Well, Rachel has a question to ask. So Rachel, I've just unmuted you if you're happy to ask your question.
Thanks, and thanks, Ray. That was a really great presentation. Lots of really detailed sort of and practical learning. In his presentation, talked about what he would ask from commissioners or policymakers. I just wondered if you have anything thinking about that wider, longer-term systems change. What would you like to ask for?
I'd like to ask for more female-specific services. I'd like, you know, we're really lucky in Camden to have women-only day centre for women who are involved in prostitution. I'd like more boroughs to have those. I'd like more female hostels. I'd like female-only in sex day centres and in homeless doctors' surgeries and in drug clinics, because like a lot of the women I work with feel really unsafe around men. and be encouraged to access more services if they were like gender specific times. But yeah, that would be really important.
Thank you, Liz. Well, I'm conscious of the time, and we've gone over slightly, so thanks to all the attendees for joining us and staying with us a little later than 12. If you do have any questions after today for the speakers, they're happy for you to contact them directly. So their details are up on the screen now and as are mine. So anything we can help you with, please do get in touch. So a huge thank you to the two speakers. So thanks to Rachel, Ian and Ray for their presentations, and for all attendees for your kind of discussion with those as well. I have found the session useful. So we will be with the webinar, so that'll be uploaded after today, and I'll send a link round to you all for that as well. So to keep up to date with the national evaluation and any upcoming learning events, then please do follow us on Twitter, sign up for the quarterly newsletter, or just visit our website. So the details for those are on the screen. So that's everything from me. All that remains to say is thanks for joining us. Lovely afternoon and happy